Yes, let us see the case study of this Conn syndrome. So, what is this Conn syndrome? Actually, it is a primary hyperaldosteronism, which is otherwise known as this Conn syndrome, which is otherwise known as primary hyperaldosteronism. This one is a endocrine disorder. What will happen here? Here, the adrenal glands produce too much of hormone. That is, aldosterone will be produced more. That will lead to high BP and low blood potassium. That is hypokalemia. So, this Conn syndrome, the symptoms will be there will be too much of high blood pressure as well as low blood potassium. Yes, Kamali, can you able to explain the types of this Conn syndrome?
There are different types of Conn syndrome: aldosterone producing adenoma, bilateral idiopathic adrenal hyperplasia, familial hyperaldosteronism, adrenocortical carcinoma. Nayantara, can you explain the symptoms of Conn syndrome? Symptoms of Conn syndrome: hypertension, muscle weakness, fatigue, excessive thirst, numbness or tingling sensation. Selvi, can you explain the causes of Conn syndrome?
The causes of Conn syndrome are benign adrenal tumors, enlarged adrenal glands, adrenal cancer, genetic predisposition. Yamuna can explain about the drug used in Conn syndrome and about its synthesis and mechanism of action.
Yes, spironolactone is an example for treatment of Conn syndrome. This is the nucleus of spironolactone. It is made up of nucleus, cyclopentanone perhydrophenanthrin nucleus, in which a lactone ring is attached to it, and then thioacetyl group is also attached to it. Actually, spironolactone is also used for cirrhosis of liver and aldosterone secreting tumors and renin hypertension. Let us see the synthesis of spironolactone. Estrogen derivative is treated with propargyl alcohol, which is also treated with potassium tertiary butoxide, which leads to attachment of this propargyl alcohol group to the cyclopentan ring, and it is followed by reduction, which this triple bond is formed to single bond, which is followed by treatment with chromium trioxide. This chromium trioxide leads to formation of cyclopentanone ring. Now it is treated with
tetrachlorobenzyl.
tetrachloro. This is followed by treatment with tetrachlorobenzoquinone and also treatment with thioacetic acid. We get spironolactone. Spironolactone acts by this following mechanism. Aldosterone from adrenal gland is secreted. The spironolactone attaches to the mineralocorticoid receptor and it decreases the aldosterone secretion from the adrenal gland, and this decrease in aldosterone leads to the increase in sodium excretion and decrease in sodium excretion, which is responsible for decrease in blood pressure and decrease in fluid retention. This leads to the treatment of Conn syndrome because the decrease in blood pressure is used to treat Conn syndrome.
So let us see a recap of this Conn syndrome. Actually, we already studied about this one. So there will be a high blood pressure and a low potassium level will be there. So we already discussed about the types, that is aldosterone producing adenoma, bilateral idiopathic adrenal hyperplasia, then familial hyperaldosteronism, then adrenocortical carcinoma. The symptoms will be hypertension, there will be high blood pressure will be there will be muscle weakness, fatigue, excessive thirst, numbness or tingling sensation will be there. So these are not the symptoms that is present in this Conn syndrome. The causes will be benign adrenal tumors, enlarged adrenal glands, adrenal cancer and genetic predisposition. As she already discussed about this is synthesis of this spironolactone. So the basic nucleus will be cyclopentanoperhydrophenanthrene nucleus. A 5-member lactone ring will be attached here. So in addition to that, in 6th position, it contains a thioacetyl group will be present in that. So what is the use of this? Apart from this Conn syndrome, it is used for the treatment of cirrhosis of liver and aldosterone secreting tumors as well as high renin hypertension. So this is about the Conn syndrome and the drugs used for the treatment of spironolactone. Conn syndrome. This is the drug that is used for the Conn syndrome. I hope you could understand. Thank you all.